Hi everyone. I was told if I was feeling nervous today to picture you all in your underwear, but I don't want to see that, so moving along. My name is Sam. I'm in the BA program, and I will be talking today about creating surveys for a pilot project. I conducted my practicum placement with the Healthy Schools program in the Public Health Department. Healthy Schools promotes comprehensive school health by partnering with schools, school districts, and communities so that they can access resources, programs, and services to create healthier communities, environments, and students. The main project I worked on in my practicum was the Immunization Education Pilot Project. The Immunization Education Project aims to teach basic vaccine education through a PowerPoint presentation to improve health literacy and health outcomes and reduce anxiety and stress. It also aims to teach grade 6 students about the vaccines they are able to receive, including hepatitis B, chickenpox, and human papillomavirus. These are the surveys. Just kidding, not yet. My role included being a part of the design, implementation, and evaluation of the project, and my case focuses on developing non-experimental pre-test and post-test surveys. The surveys were developed to evaluate whether or not the project was successful and determine what students already knew about vaccines, what they wanted to know, and what they had learned. These are the, These are the surveys I created, and as you can see, they are very informal, and most of the questions are the same or similar. I presented the pre-test survey to the students, followed by the vaccine education by the lead public health nurse, and then I presented the post-test survey to the students. I drafted the survey questions from the PowerPoint, and I made them measurable against the outcome measures of the project. The students were surveyed, data was collected and analyzed, and I used the results to create recommendations in a final report. There were a number of skills and knowledge I used in the creation and implementation of the surveys, but today I'm focusing on the facilitation of health literacy and written and oral communication. As the project aims to improve health literacy, surveying students pre and post gave us a better understanding of what students knew and their health literacy levels in relation to vaccines. The surveys were also written in plain language. This ensured that they were understandable to each student, and this proved to be useful as one student wore a hearing aid, and she was able to read the material in case she could not hear it as well. Plain language in terms of oral and written communication also supported the surveys in providing clear instructions and directions. I thought it was important to have the surveys presented verbally by myself, but also displayed for students to read in case they misunderstood or could not hear the question and answers. There were a number of things that did work. There were a number of things that did work with the project. The results showed that students had a good sense of knowledge of vaccines in the pre and post test. The surveys were understandable to the students, and we received great feedback from students about what they would have liked to have known before they received vaccines. There were also a number of things, oh my goodness. What did not work? Yes. There were also a number of things that did not work. The informal way of asking students to raise hands was not very effective. The method of counting also limited the survey results because in many questions, too many or too little students were accounted for. The students also had already received their grade 6 vaccines, therefore they may know more than other students who had not yet received them. Okay, I missed these too somehow, going back. In terms of public health and social policy values, the project supported a number of partnerships. Communication was essential to fostering the partnerships and being able to survey and gain feedback from students. And working with other professions, disciplines, and people proved to be beneficial for the project, as a number of perspectives strengthened the project and helped to build the relationships and partnerships. Finally, what did not work? The limitations were useful in understanding takeaways, the gaps, and where changes can be made to improve the project, including strengthening the evaluation design and measuring health literacy. It is also important to note that health literacy components, such as teach back, encouraging questions, and showing examples are positive ways to help students understand and evaluate health information. Lastly, we used evidence-based research and aimed to educate students, not scare them into making health-related decisions. Thank you. Oh, my arrows were so off there.
Okay, questions for Sam? Is there a question back there? No? No? Sure.
I was just wondering, since the implementation of the HPV vaccine, which is now boys can get it, so having that taken into consideration, how to engage, obviously, both sides of the gender in that, if that was a consideration that you have to make, because obviously before it was, depending on which age group you got it in, it was specifically only for young females.
Yes, and when we were doing this, that was just sort of getting out the word. So going forward, if the project does go forward, it will be definitely talked about with the students, because that is something that the boys do need to know, is that it's not just a vaccine for girls.
Thank you.
Any other questions? Okay, looks like there are not. So thank you very much, Sam. That was very interesting.
Thank you.